My name is Fusi and this is my role play on the infectious control. Hand hygiene is essential to prevent the spread of infections. Here are five moments we need when hand hygiene should be performed. Number one is before and after patient contact. Two is before any aseptic task. Three is after body fluid exposure. Four is after patient contact. And five is after any contact with patient surroundings. So now I will proceed into demonstrating how we would use hand rub for hand hygiene. So first off, we will need hand sanitizer that is 70% alcohol or more. We would need the right amount, just enough to cover half of your palm. Second step, we will go into rubbing the surface above our hands on our palms, and then we will continue to go in between our fingers like so, and then continue on the other side. Fifth step, you can get in between the areas that is hard to reach, and then to ensure we have everything, we can go for the thumbs too, and then we can kind of rub off just to make sure the hand sanitizer is in the right places, and then we have a dry sanitized hand. Thank you. Respiratory hygiene and cough etiquette. To prevent the transmission of all respiratory infections in healthcare settings, including influenza, infection control measures should be implemented at the first point of contact. We can use visual alerts, respiratory hygiene, cough etiquette alerts, mask and separation of persons with respiratory symptoms, and droplet precautions. The following measures to contain respiratory secretions are recommended for all individuals with signs and symptoms of respiratory infection. First, cover your mouth and nose with the tissue when coughing and sneezing. Second, use the nearest waste receptacle to dispose of the tissue after use. And third, after coughing or sneezing, perform hand hygiene. And lastly, wear a mask if you are coughing or sneezing constantly. Droplet precautions. Mask and separation of persons with respiratory symptoms. Encourage coughing persons to sit at least 3 feet away from others in common waiting areas. Thank you.